My name is Denise DiCicco, and I'm the Lactation Services Coordinator here at Henrico Doctors Hospital on the Forest campus. The World Health Organization and the American Academy of Pediatrics recommends breastfeeding for at least the first 6 months exclusively, with breast milk being part of the baby's diet for the first year. Here at Henrico Doctors Hospital, we really try to promote breastfeeding and help you to meet the goals for your breastfeeding experience. So just to name a few of the benefits as to why we think it's important for you to breastfeed. As far as the benefits of breastfeeding goes, there's many for mother, for baby, and for her community. Antibody protection is one of the biggest benefits that you can provide to your baby. Anytime that you have been exposed to any viruses or other illnesses where your body has made antibodies, you're providing that protection through your breast milk to your baby. Decrease in obesity comes from the baby's ability to be able to regulate their hunger and their satiety cycles. So that this way it is very difficult for babies to overfeed when they're actually breastfeeding, because they're eating when they're hungry and they're stopping when they're full. There's a decreased risk of sudden infant death syndrome because babies who are breastfeeding frequently are not really in a very deep sleep. And so while they may appear to be sleeping and they may appear to be in a deep sleep, because of their hunger, they will be waking up to feed more frequently. Therefore, there's a decrease in sudden infant death syndrome during the time that you're breastfeeding. So human milk is for human babies and cow's milk is for cows. And so therefore, because the baby is able to digest human milk much easier than cow's milk protein, there's a decreased incidence of allergies during the time that the baby's breastfeeding, because the baby does not have to work so hard to digest foreign proteins. For mothers, there's a decreased risk of cardiovascular disease, decreased risk of blood pressure, decreased risk of obesity, decreased risk of diabetes during the time that you're breastfeeding, as well as also the decreased risk of reproductive cancers while you're breastfeeding. Both mom and baby will be able to gain these benefits from breastfeeding. The longer the better. So the longer the duration of breastfeeding, the better that you're going to experience these results. For economical benefits, did you know that if most mothers in the United States breastfed their babies according to the World Health Organization and the American Academy of Pediatrics guidelines, that we could potentially save 13 billion, that's billion with a B, healthcare dollars. And that's important as we're looking at healthcare as one of major topics here in the United States. Not only do we have benefits of breastfeeding, but there are certain risks that come with formula feeding. Because formula does not provide and does not have the ability to provide antibodies, your baby may experience more risks in infections, especially those of like ear infections, because of those lack of antibodies. There's a potential for food allergies as we try to have the baby ingest particles that are really not those particles that the baby's delicate intestinal system are ready to digest at the time. The baby may refuse to come to the breast, so that if we are giving the baby too many bottles, the baby may get used to a faster flow, may get used to a different volume of food, and so therefore at the breast, babies really want to eat as easy as possible. They really want to grow, and they want to grow the easiest and fastest way possible. So if we're introducing too many bottles to the baby's really not going to want to have to work any harder at the breast. In addition, we may experience latching difficulties as the baby has to suck very differently from a bottle than at the breast. Because there's a decrease in practice at the breast, then we might also experience a decrease in milk supply because the breasts aren't being stimulated and they aren't being drained as effectively as possible. Inherently, there are some risks to formula, and if you have any further questions, please make sure to ask your lactation consultant or your nursery and postpartum nurse.